Hello, I'm Dr. Inman. This is a miniature lecture on inappropriate urination in the feline. This is an age-old disease process presented to veterinarians on a regular basis. The kitty cat, their beloved kitty cat, decides to use the inside of the house as a toilet. They may have a box that they ordinarily pee in, but they miss it all the time, or they don't beg to go outside to basically void, but they just decide to start to urinate in the house. One of the problems is the cat is an interesting creature. I've done my master's research on neurology, and when we hook an EEG up to a kitty cat and let it walk around, essentially, and we measure it with telemetry, we find out that the cat, most of the time, is sleeping. The actual delta waves that are being produced when the cat is just walking around looking at everything in the world, essentially, and also when the cat is sleeping, the EEG looks almost exactly the same. So the cat most of the time is sleeping. Nonetheless, the cat is an olfactory creature, and so if the cat comes across an area that smells like pee because they peed there before, they'll invariably get a response, a triggered response in the body to void. So they'll sit down and they'll start to urinate. They don't even know what they're doing. Okay, and so because of that, that's kind of unfortunate. And then if you find the cat doing it, yell at the cat almost like goes, "What? Oh my God, I'm peeing in the house." That's just not okay. And so the kitty cats basically will, if somebody's not there yelling at them, they'll just go ahead and continue to urinate and go along their own way, and the animal's still in delta waves, essentially. So the cat never really wakes up, which is an interesting consideration, essentially. So our approach to treating these conditions, essentially, is involving, for inappropriate spraying and also inappropriate urination, is to make sure that the animal doesn't have a bladder infection. We do that with antibiotic therapy, urinalysis, etc., and we can treat a bladder infection. They don't have feline lower urinary tract disease or feline urolithiasis syndrome. We can treat all of those. I'd have you relate to the previous lectures that we've had on those particular things. Once those are ruled out, what you have is a problem that can be involved in the actual environment where the house, even though you can't smell it, the cat can easily smell it in the rug, and we may have to use white vinegar or something else to try to remove the smell of urine from the rug, because as far as the cat's concerned, that particular rug area that it's peed in before is just like their cat box, and so they're going to smell it and they're going to say, well, I got to pee here. And so that can be a problem. That can be a real difficult problem in wood floors once the urine actually soaks into the wood, because it cannot be effectively removed from the wood in some cases, and so all of a sudden you have to get rid of the house or get rid of the cat if in fact that's a particular problem, or relegate the cat to the out of doors. I have to tell you that we have treated these cats with all kinds of different therapies, and we've treated these cats with laser therapies as a means to try to ameliorate these animals that still will not respond to the kinds of things that we have used classically to take care of it. And the success rate for inappropriate urination is tepid. It's not that fantastic. What we do is we will adjust these animals classically, because this is what we do, and we show you how to do that in Module 1 and Module 4. And then we utilize a somatovisceral approach to make sure they have adequate blood supply to all their tissues, which is another thing that we routinely do. And then we'll treat these animals with a series of frequencies for a sympathetic overstimulation followed by a parasympathetic overstimulation. That's 216 cycles per second and some other ones, and 240 cycles per second. And what that does is optimizes the autonomic nervous system in this animal, so we can minimize the problems that may in fact be neurological in nature. After that, we basically might be left with a kitty cat that chooses to urinate in the house because the cat really is smelling the urine in the house and doesn't wake up enough, essentially, and so mindlessly will walk into an area, smell the urine smell that we can't get out of the rug or the floor, and decide that it needs to void there. It may void anywhere else. It may smell the area, one particular area of the house, and then decide to go off into the corner and urinate in that corner, essentially, too. So it doesn't necessarily have to be one specific spot. This has been a lecture on inappropriate urination. I wish I could give you a better solution for this. This has been the bane of veterinary practitioners, and we're working on kitty cats for the last 100 years, essentially. And so there are other approaches that we can use for this. However, I do not recommend the use of selective serotonin uptake inhibitors or kitty Prozac to treat these animals, because they're already kind of like they're already kind of asleep to begin with, and to put them under the effects of that kind of sedative type of or dissociative type of medication gives rise to lots of other types of problems. This has been a lecture on the inappropriate urination in the feline. I'd have you go to the vomtech.com website, and we can actually show you a little bit more about what it is that we can do. We can also show you how to do the technique, and we do so for free, essentially at that particular site, in hopes that you will look at the other things that we treat, about 2,700 different disease conditions we've mapped out, and how to treat that veterinarians don't treat very well at this point. Thank you, and have a great day.